Good evening. Today's discussion is about children and broken bones. Although the term fracture may sound so serious, it is just another name for a broken bone. As you probably remember from your own childhood, fractures are very common, especially in children. In fact, they are the fourth most common injury among children under the age of 6. Falls cause most of the fractures in this age group, but most of the serious bone breaks usually result from motor vehicular accidents. And to discuss about this, we have with us today Dr. R Sankar, Senior Consultant, Pediatric Orthopedic and Spine Surgeon at Apollo Children's Hospital, Thousand Lights, Chennai. Good evening, Doctor.
Good evening.
What are the causes of bone injuries in children, Doctor?
As you have already mentioned, the most common injury is due to fall. Fall either while playing or while crossing the road, or sometimes fall from the height is the commonest causes in our country. This will produce sometimes a simple fracture, or the fracture can be open fracture where the bone is exposed to the outside the skin. Sometimes motor vehicle injuries will result in a high velocity injuries where the bone can be shattered into multiple pieces.
And do children's bones break very easily?
No, it's not like that. The children's bone is different from adult bone. We call children's bone fracture as a green stick fracture. If you break a green stick, it bends. It doesn't completely break. Whereas the adult bones, you break. It's like a dry bone. It breaks into two pieces and moves away. So it's easier to treat a children's bone because it doesn't move out of place too much if the injury is not severe enough.
One of a very common question that we've received is why does my son keep breaking his bones so often?
No, that's actually not the right way to look at it. Any child who is very active, running around and playing in school, there is an increased chance of the child falling and breaking the bone. Sometimes you can see a child falling from the first floor or the second floor of the building, getting up and walking without any injuries. But the way you fall down will result in a broken bone. If you fall on an outstretched hand, it can break the forearm bone or the arm bone or sometimes the collarbone. If you, while playing football, if you run and twist your leg, the leg bone can be fractured. So it's the activity sometimes results in multiple fractures, but that doesn't mean that the child cannot be active. Activity also helps the bone to become strong.
My 6-year-old son has an ankle injury and can barely even walk. It's almost 72 hours now. Is it okay? Is it a sprain or is it a bone fracture?
So any bone, if it's broken, it will take about 4 to 6 weeks to heal. Till that time, the child will not be able to put any weight and walk around. If the child has only sprained an ankle, child will be able to walk but with a limp. But if there is a crack in the bone, the child will not be able to put any weight.
Are weak bones also one of the causes of bone fracture, doctor?
That's right. The thing is, if the bone quality is not good enough, there are some diseases like a brittle bone disease. In those cases, even a very trivial injury will force the child to break the bone. But if the bone is weak because of the calcium deficiency or a vitamin D deficiency, or the child is not very active, also can cause fractures in children.
And do bones bleed when broken or injured?
Yeah, the bone, when the bone is broken, always it will bleed because the bone has increased blood supply. Uh, so any bone breaks, it will bleed. That blood collection around the broken bone only helps in the bone to heal.
How do fractures or broken bones occur in younger children, as in kids who are as early as infants, who are 1 year old, 1.5 years old?
Child's fracture happens only when the child starts walking or running and playing. If a child who is not able to walk happens to have a fracture, always we suspect non-accidental injuries, otherwise a brittle bone disease. If there is no evidence of a brittle bone disease, non-accidental injury has to be ruled out. This is not that common in our part of the world, but still it is something which we have to seriously look into.
And how do we identify this brittle bone disease, doctor?
Brittle bone disease is a clinical diagnosis by taking X-rays of the long bones, skull X-rays. We can see a classic findings of the brittle bone disease. When you look at the non-accidental injury, when you do an X-ray of the leg or the arm, you'll you will see multiple fractures at a different age group. One fracture broken and healed about 3 months back, one fracture broken and healed 6 weeks back, one fracture still healing. So if you see a fracture at multiple periods, always suspect non-accidental injuries.
How long does it take for a fracture to normally heal in children?
In children, again, depending on the age, when a child is born, at the time of delivery also there is a possibility the bone can fracture. The common fractures are the collarbone fracture or the leg bone fractures. These fractures at the time of birth, if it happens, it takes only a week to heal. uh, Up to walking age, about 2 to 3 weeks. Up to 7 years, about 4 weeks. After that, about 4 to 6 weeks for the bone to heal. The healing doesn't mean the bone is strong enough. So if the bone takes 6 weeks to heal, it takes further 6 weeks to become strong.
What should I do if my child breaks a bone or dislocates a joint? As in, what should I do immediately?
The immediate first aid is to immobilize the part which is broken. If there is no open wound, there is no bleeding, you put a pad and roll a bandage so that the leg or the arm is not moving, so that will help to get rid of the pain. If the child is in a lot of pain, you can give pain medication and then shift the child immediately to the hospital for further management, investigation and management.
We've had a lot of questions about parents asking us, how can I keep my kid's bone healthy?
See, the bone, there are two parts to this thing. The bone healthy is because of taking more minerals and making the bone strong. The bone strength comes from more activity. If you allow the child to go out and play, putting loads of weight and moving will make the bone strong. Also, 99% of the body's calcium is stored in the bones. So you have to have adequate calcium for the child to have a healthy bone. For calcium to be absorbed from the tummy, you need vitamin D. The problem with the vitamin D is the only source of vitamin D is sunlight. You take any amount of vegetables or of meat, doesn't have any vitamin D. So exposing the child to sunlight, giving plenty of food with more calcium content, and keeping the child active will make the child's bone healthy.
Should I give calcium supplements for bone strength?
When you look at the vegetables and the fruits, a lot of like vegetables, like green vegetables, spinach, milk and milk products, soy, pulses, egg, meat, all have a lot of calcium. If you give normal food in normal quantity, it has enough calcium for the child to have enough calcium. But if you think the child is not getting adequate calcium, or the child is allergic to milk, there is no harm in giving supplemental calcium in the form of syrup or tablet.
How or when should a parent worry about a child's broken bone, doctor?
Child's broken bone, see, there are good thing about the broken bone. There are only one or two tissues in the body. If it's damaged, it will get back to the normal shape without any problem. The bone is one. If the bone breaks, it will heal. The doctor's job is to make the bone in its alignment so that the bones heal in the straight line, so that the child will have a good quality of life. But children's bone is a growing bone. If the break happens at the growth plate, or if it's moved out of place, or the bone is protruding out with the open injury, then we have to take extra care in managing these injuries.
My 7-year-old daughter has sprained her ankle during a dance rehearsal. It's not a fracture, but the doctor says it's a ligament injury. Does she need a plaster? Because right now she has nothing but just a mesh around her leg.
See, as I told you, the bones heal as a bone, but when the ligament is torn, it heals with the scar tissue. So when the ligament is torn, always better to immobilize that part with a plaster cast for about up to 3 weeks, so that it will heal well, for the child to have a good ankle movement at a later stage. If you don't immobilize properly, always that ankle will be unstable when the child becomes big.
My 11-year-old had injured her hand during an accident 6 months back. I have taken all the treatment in all possible ways at a hospital, but till now she is not able to turn her hand properly. Uh, it is it dislocated or is it permanent damage? Kindly advise.
If the bone is broken, it can heal in straight line. That won't affect the movement of the forearm. But if the bone is healed in the wrong position, that will restrict the forearm movement. So you cannot turn the hand up or turn the hand down. That is not because of the dislocation. That is because the fracture has healed in the wrong position.
How does physical activity help my kids' bones?
Like how, why people go to the gym to do workout to make the muscles bulky, the same way physical activity also puts a lot of uh, pressure on the bone. Putting a load on the bone makes the bone healthy. That's the same thing. Like if you immobilize the bone, like if the bone is broken, if you put a plaster, when you remove the plaster, the bone initially is weak. That's why we give physiotherapy to make the bone strong. So if somebody is lying down in bed for 6 weeks or 3 months, the bone also become weak. That's why when we make them mobile, we just give physiotherapy to strengthen before they go out and do their routine activities.
My child fell down in the bathroom a month ago and hurt her elbow, and it was swollen. Doctor said it's not a fracture but maybe a ligament injury. He had prescribed medications, but even after a month the pain has gradually decreased, but she is still not completely okay. Where What is going wrong, doctor?
See, the commonest injuries we see in children are around the wrist and the elbow. If the X-ray taken at the time of fall hasn't shown any fracture, we can usually repeat the X-ray after a week or 2 weeks. If that X-ray shows no evidence of fracture, then you just give rest for the tissues to heal on its own. Usually, any elbow injuries will result in stiffness of the elbow, but gradually it will get better on its own. There is no need to worry about and going and arranging physiotherapy in a child.
What is clubfoot, doctor? Is it a disability and how does it happen?
Clubfoot is a congenital anomaly where foot, either one foot or both feet, turn inwards. So when the child is born, if the foot is turned inwards, if you don't treat these children, when they start walking, they don't put their sole of the foot on the ground, rather than they walk on the top of the foot. That's why it's called clubfoot.
Is it something that's congenital, doctor?
It's a congenital problem, but we don't know why exactly this is seen only in few children. Sometimes we see clubfoot in families where they already had a history of clubfoot. But clubfoot, even though it's congenital, even though the foot is small compared to the other foot, or if both feet is involved, feet and the legs small, we can treat and we can make the child perfectly all right for them to get back into their routine activities without any problem.
There is uh, a saying that not enough amniotic fluid during pregnancy could be one of the reasons for clubfoot.
Yes, that is a reason, but not all the babies delivered with a less amniotic fluid has a clubfoot. So we cannot say that is the only reason for the child with a clubfoot.
And,
I will make it very clear. When a child is born with a clubfoot, you cannot blame the mother. Mother is not the only cause for clubfoot.
and is it completely treatable, doctor?
It is 100% treatable with a serial plaster cast alone, followed by a small tenotomy. Usually, we treat them for up to 6 weeks. By the end of 2 months, the child foot looks as normal as any other child's foot. Only thing is, child has to wear a special kind of a shoe for up to 2 years for that not to recur again.
Thank you, doctor. Earlier, you spoke about how can parents help their children get enough, uh, you know, strong bones. What is the importance of sunlight in the development of stronger bones?
See, as I told you, whatever amount of calcium you take, whether with a supplement or vegetables or meat, the calcium will not be absorbed from the intestines unless the child has enough vitamin D. Unfortunately, the only source of vitamin D is sunlight. So if you are not exposing the child to sunlight, there is not enough vitamin D, so the calcium is not absorbed, the bones become weak. It's a vicious cycle. One is not there, the other gradually goes down, and the child gets into weak bone and the fractures.
Can you list the most common types of fractures in children, doctor?
The common type of fractures happen because of the fall on an outstretched hand. When the child falls on an outstretched hand, the wrist fracture, distal radius fracture is the commonest one, followed by elbow fractures. Elbow fractures sometimes displaced. If it displaces, it may damage the nerves and the vessels going around. That needs a special attention. Followed by collarbone or upper end of the arm bone is a common fractures.
What
Leg
is
bones are very rare. Sometimes when a child starts walking, they trip and fall and start complaining of pain over the distal part of the leg. We call this toddler's fracture. Initial x-ray may not show any fracture, but if you x-ray after a week or two, you can see a faint fracture healing. It's called a toddler's fracture. There is no need to worry about these fractures.
Are obese children or children who are on the heavier side more prone to bone injuries and fractures, doctor?
The thing is, obesity on its own doesn't make the child prone to more fractures, but the child is obese because of inactivity. That inactivity and overeating will result in more fracture than the obesity on its own.
Does fracture in a child get diagnosed by the parent initially?
No, the thing is, sometimes the children who cannot talk, they cannot come and explain to the parents that they fell down anywhere. But if the child is not using the arm, not allowing you to touch the arm, or the leg is swollen with a restricted movement, always suspect an injury, commonly to the bone.
What is a splint or a cast, doctor?
Splint is something which is used to immobilize. In a normal situation, even a foot scale, the wooden foot scale or a plastic ruler can be used as a splint. It's mainly to immobilize the broken part of the bone to prevent any movement. This movement will reduce the pain. Also, this movement will not allow the tissues inside to get damaged more. Plaster cast is the one is applied by the doctor when you come to the hospital, where the broken bone is set right under anesthesia, or if it's mild without anesthesia, and put. Sometimes this plaster cast can be a half plaster cast or a full cast depending upon the nature of fracture.
My child has a broken bone, and the doctor has advised surgery to put the bones back in place. Is it advised for every bone injury?
No, surgery is very rarely done for children's fracture, but the bone is moved out of place or close to the joints, or if it's displaced and something is interposing, then surgery is indicated. We don't do surgery like what we do it in adults. We have a special implants and instruments for children's fracture to be treated. So we don't treat a children's bone like an adult bone.
Having said that, can you tell us a little bit about the orthopedic department at Apollo Children's Hospital, Thousand Lights, Chennai?
Apollo Children's Hospital is an exclusive children's hospital with 24 hours emergency care, supported by ambulance and paramedical staff to bring in emergency patients. We also have intensive care unit, neonatal and pediatric intensive care, with 3 operating theaters and cath lab, with a orthopedic surgeon, pediatric urologist, plastic surgeon, vascular surgeon, and cardiac surgeons around 24 hours a day. So we can handle any kind of an injury. For an example, I can tell you, a child came with a thigh bone fracture, run over by a vehicle, came with a vascular injury. So we had a vascular surgeon, plastic surgeon, orthopedic surgeon, the pediatric surgeon involved. We could able to save the limb because there was a multidisciplinary involvement in the condition.
What is a vertebral compression fracture, doctor?
What if you look at the back of the spine, we have vertebral body from head to pelvic bone. Each vertebral body is rectangular in shape. If you fall from a height with sudden flexion injury, or if you have a sudden injury to the back while traveling in the car, vertebral bones can get fractured. Usually it's like a honeycomb like a structure. It gets compressed, so instead of a rectangular shape it can become like a triangular shape. Once the shape is reduced, it's very difficult to get back to its normal height. But the problem with this vertebral fracture is if this bone fragment displaces backwards, it can press the spinal cord and cause weakness of both legs and involvement of the bladder and the bowels. This is more common in motor vehicular accidents or fall from very high buildings.
Hello, doctor. There is a history of osteoporosis in my family. How do I evaluate my child for osteoporosis? Is it something that comes even in childhood?
No, osteoporosis we don't see in children. We call it osteopenia in children. That is because of inactivity you get osteopenia. We don't do the same kind of a test what we do in adults like a DEXA scan in children. So if the child is very active and have an adequate nutritional support, they don't get osteopenia.
Can you tell us a little bit about bow legs, doctor? Do we have a lot of
Yeah,
children coming in?
we see children coming to our clinic, about a 2-year-old child, 3-year-old child with the bow legs, and 4 5-year-old child coming with the knock knees. It's more of a parental and grandparents concern rather than the children's problem. These children run and play like any other normal child, but the parents are very worried. If a child comes with a bow legs or a knock knees, it's involving both legs, it's symmetrical. If it's not progressive, we are not worried about that. Whereas only one leg is involved or one leg is more involved or progressive, then you need an urgent opinion from an orthopedic doctor.
Can it be corrected surgically or
Usually, physiological bow legs, symmetrical, non-progressive bow legs corrects on its own. But bow legs, because of any disease like any fracture or infection, yes, we have a treatment available in the form of surgery.
is it genetic, doctor?
No, bow legs is not genetic. There is again bow legs and knock knees are physiological variation. Like how some people are tall, some people are short, some people are fair colored, some people are dark colored. So the same thing like that. The leg doesn't have to be straight. It can be little bit bow or little bit knock knee. That's normal. But if it's more than certain degrees, then we consider that is not right and we advise treatment.
Is it true that inadequate vitamin D is one of the reasons for bow legs and knock knees?
That's right. Usually, if you have inadequate vitamin D, there is not enough calcium. So the bone doesn't have enough strength to hold the baby's weight. So when the child starts walking, the bones become bow-legged. In these children, the deformity is progressive. That's why you need a doctor's advice and treatment. These children, if they are treated adequate enough, will heal without any surgical management. The same children with the rickets or vitamin D deficiency problem coming at a later age, 4 or 5 years, usually we think about deficiency due to some other problem. If a child presents at the age of 2 or 3 years, we think it's more of a nutritional deficiency rickets, whereas child coming at the age of 4 or 5 years, we usually think it may be hypophosphatemic or renal rickets. In this situation, it's better to get the physician's opinion or an orthopedic opinion.
How does a parent identify bow legs, doctor?
You can see that is the parents don't have to identify. Usually, there are other people around them come and tell the parents there is a problem with the child. You better take the child to the doctor. That's what I'm telling. It's more of a parental or grandparents' concern rather than the parental concern.
And
When the child has a bow legs, is due to vitamin deficiency, they'll walk like a duck, waddling gait. So if the child has a waddling gait with a bow legs, think of nutritional deficiency rickets.
is it completely curable,
It's
doctor?
100% curable. The deformity also corrects 100% normal. There's nothing there to worry about. But earlier the diagnosis and treatment, full recovery is possible at an early stage.
Do bow legs get worse with age as the child ages?
No, Bolex, no. Bolex or physiological Bolex doesn't progress. It stays as it is.
Thank you, doctor. What is your message for our viewers today?
My main take-home message here is allow the child to go out and play as much as the child can. I know the child is under a lot of tremendous pressure at school, at tuition, and you have to study hard in your life. But if you don't have a good health, whatever education the child has is of no use. So more activity, exposure to sunlight, good food, that's all I can advise. Three things: more activity, good food, exposure to sunlight. It's very important things for a good quality of bones. Thank you.
Thank you very much, doctor.
Thank you.
For appointments with Dr. R Sankar, Senior Consultant Pediatric Orthopedic and Spine Surgeon at Apollo Children's Hospital, Thousand Lights, Chennai, you may reach out to 044 2829 8150 and 967705 3787. I repeat, 044 2829 8150 and 9677053787. Thank you, doctors. Thank you, viewers.
Thank you.